Hello guys, welcome back to my channel once again. I'm Sajan Dahal, MBBS student at RIMS Imphal, and today I'm going to teach you about the arteries of the lower limb. But before moving on to the arteries of lower limb, I would like to give you guys a brief overview of the arteries we will be encountering in the lower limb. So let's first write down their names. So the common iliac artery will give two branches, which will be the external iliac artery and then the internal iliac artery. The external iliac artery will be known as the femoral artery after it has passed through the inguinal ligament. The femoral artery will be further, as it moves down further its course, it will be called as the popliteal artery as it passes through the adductor hiatus and moves to the posterior part of our thigh. Then the popliteal artery will further be divided into the anterior tibial artery and the posterior tibial artery. The anterior tibial artery will, as it moves further down its course at the imaginary line between joining the two malleolus, it will form the artery, not form actually, but it will be called as the dorsal pedalis artery. And then the posterior tibial artery will give a branch, called the peroneal artery, and it will further move below its course and later on terminate itself forming the medial plantar artery and then the lateral plantar artery. Now the internal iliac artery, the arteries have a lot of branches, but we are right now concerned only with the arteries that are involved in the lower limb. So the internal iliac artery will have two trunks, that is the anterior trunk and then the posterior trunk. I'm repeating again, the internal iliac artery doesn't only give off this branch, it also has a lot of other branches which supply to the abdominal and the pelvis side. But right now we are concerned only about the arteries that supply the lower limb, hence therefore we are only focusing on the arteries which we will encounter in the lower limb. So let's first go to the posterior trunk. The posterior trunk will give the superior gluteal artery, and then the anterior trunk will give the obturator artery and then the inferior gluteal artery. That's it. Now let's move on further to the drawing. But before you move on further to this video, I want you guys to pause the video and try to remember every name of it and try to draw these flowchart out so that when you encounter the new names you will find it easier, because as you know, anatomy is nothing but the study of something which lies at the anterior and which has a relation with the posterior passing through the medial to the lateral. That's it. It's so confusing. So first you try to learn about the name and then only you move on to the further part of the video. So coming on to the further part of the video, I'll start with the drawing. First we will draw the anterior compartment, actually the anterior compartment, and then we will I will upload a next video on the posterior compartment or the plantar part. So as I'm saying, the anterior compartment, so I'll start with the external iliac artery. The external iliac artery will first, where's my green color? I don't know. So imagine this is the inguinal ligament. So after passing to the inguinal ligament is the femoral artery. The femoral artery further down will pass on through the adductor hiatus and form the popliteal artery. The popliteal artery at the lower border of the popliteal fossa will give out as the anterior tibial artery and then the posterior tibial artery. So this will form first by passing through the interosseous membrane. Then now let's move on to the branches. So in this branch, the femoral artery actually has few branches. I'll also write the name here. This will be the, I'll just first finish the drawing and I'll write the name later. Okay, so one branch, two branch, and then three branch, and then these are the superficial branch. One, two, and then three. This is for the femoral artery. So again I'll draw for the popliteal artery also. One, two, three, four, five. So now let me start naming them. This will be the superficial epigastric artery, and here another deep branch which I have forgotten. Yeah, so this one will be the superficial external pudendal artery. So this one will be deep external pudendal artery. Then again, this will be the muscular branches, muscular branches. This will be the descending genicular artery, and this will be the superficial circumflex iliac artery supplying the skin at the iliac crest. And then this is the main deep branch which will be the profunda femoris artery. So again I'll tell you about the branches of the profunda femoris artery. So the profunda femoris artery will form a medial circumflex artery, the lateral circumflex artery, then it will give three perforating branches and terminate itself as the fourth perforating branches. Okay, so the medial circumflex femoral artery, lateral circumflex femoral artery. This will be the medial circumflex femoral artery, the first perforating branch, the second perforating branch, third perforating branch, and then the fourth perforating branch. The thing I was saying here, see, the femoral artery will have 1, 2, 3. 3 superficial branch, and then 1, 2, 3, and 4 with the 4 deep branch. Okay, and then now moving on to the popliteal artery. This will form the superior medial genicular artery, and so this one will be inferior medial genicular artery. And for your kind information, genicular or geni is referred to the knee joint. And then this will be the superior lateral genicular artery, this will be the inferior lateral genicular artery, and this will be the medial genicular artery, the small branch you are seeing here. So this part will be called as the popliteal artery. This will be known as the femoral artery, and the remaining part I'll teach you in the second part of the arteries of lower limb.